public comment. Chair requests that there be no public comment on issues for which a prior public hearing has been held before the Board of Directors. Is there anybody that would wish to address the board? Seeing nobody. There's a summary of the January 7th, 2015 meeting minutes. Are there any changes, corrections, additions that need to be made, or are they good? Seeing nobody jumping up and down, we'll leave them as they are. We have one item, one informational item, and that is the presentation on key elements from the Healthy, Inclusive, and Livable Communities, an element of MetroVision, and Brad Calvert is going to present to us.
The chair quickly asked me if I had my speed reading glasses on tonight, and I can talk fast, and I know seeing one item you probably want to get out of here as soon as possible, and I normally would tell you I'm only going to be here for a quick update, but I would really like to spend quite a bit of time, as much time as you're willing to give me this afternoon, to talk about the two issues that we were kind of walk you through. A little bit about what's in front of you, both was linked in the packet as well as what's in the packet, just so that you have a sense of what you might want to kind of flip through and reference. Obviously, I've got a lot of slides, so I just thought it would be probably best to actually print the presentation for you, so you do have that if you want to make notes. Within the actual memo, there was a link to an issue paper that we did several months ago that actually was distributed to the board, and this group talked about, and there are two attachments as part of the packet as well, an executive summary of the regional housing strategy, as well as the outline of the work that the board's ad hoc committee on the issue of housing is putting forward for board consideration. So amongst other things, those are things that you might want to consider as I present information, then obviously hopefully you all have discussion as well. So just to give you an outline of what I'm going to cover, I'll give you a little bit of MetroVision background, just because I know there's varying levels of experience around the table in terms of this process. I'll preview these sort of two new, and I'll explain a little later why I always air quotes here new, because some of it is new, some of it really isn't. On the two issues being community health and wellness and housing, I'll cover very quickly kind of how these issues are handled in the existing plan that the board adopted back in January of 2011. Most of what I will cover are fact-finding type things we heard during stakeholder engagement efforts, data analysis, that sort of thing. And then obviously I will sort of, with each of these, talk about potential outcomes, objectives, and strategies that may be included in MetroVision that obviously this group and the board will continue to discuss over the coming months. Just so you know, the health stuff that I'm going to present has been developed by staff, but really in very strong and continuous consultation with stakeholders around the region, including technical and citizen committees that have been involved in the process. And then the housing item that I mentioned, which is I think the last 2 pages of the packet, was actually developed by the ad hoc committee that I alluded to. So taking one step back in terms of kind of what is MetroVision, and this is kind of a roundabout way to get there, but obviously as DRCOG we have a lot of functions and rules that ultimately are authorities that are oftentimes passed on to us by the state or the federal government. One of those is being a regional planning commission, right, where we have the authority to adopt a regional plan for physical development, but you can see kind of what it says on the slide. But obviously we're the NPO as well as the Area Agency on Aging. The thing that's really interesting about MetroVision is this is really the place where these three things come together. Oftentimes they're siloed to some degree, but this is the opportunity to talk about all of these issues together. What is the sort of long-term future that this region wants to set for itself, and how does that impact things like transportation and the aging of the population? And one other sort of minor kind of almost bureaucratic or planning note that I think is important to point out is that the board structure, the planning boundary that ultimately our board represents, really is that MetroVision boundary. The MPO does not include all of our board members, just like the AAA does not include all of our board members. It's the one place where everybody around the table really has a voice into something that really the board is considering that impacts everyone. Obviously, we've been doing this for a long time. The first MetroVision plan was adopted back in 1960, but for really the last 20 or 25 years, we've been sort of building this brand of MetroVision. Still in the plan today is a vision that this that the board that was present here in 1992 crafted and adopted, and we have carried that forward throughout the years. As you can see, ultimately, lots and lots of periodic updates to ensure that ultimately this policy framework really is reflective of current circumstances and the wishes of this board. So we've been working on this MetroVision update for really the last 3.5 or 4 years. So we will continue to kind of carry forward some of these traditions. As I mentioned, we've had a guiding vision since 1992. The current version of MetroVision really focused on 3 key areas, sort of growth and development, transportation, and the environment. We expect that that will continue going forward, but with each section, us taking a fresh look to see if it still remains current and valid, and then obviously some new issues as well, which is what we're here to talk about today. And we do have every expectation that the plan will remain really outcome focused. This was direction that the board gave us last time around that really brought some targets to the conversation that really described what are we going to be when we grow up as a region, right? When we hit 2035 or 2040, how will we know that ultimately the plan that we agree to work towards is successful? And if anything, my suspicion is that the next version of this plan will broaden and deepen that approach to really measuring our progress over time. So, as I mentioned, going back now 4 years, in January 2011, the board adopted what was then called MetroVision 2035. In a matter of months, actually May of 2011, the board told staff really what their expectation was for this update. And so, these sort of 6 key things are kind of verbatim from that board action, really just saying this is what MetroVision will be when it comes to this board for deliberation and adoption. So obviously our hope is that through this charge we will give you a product that gets us part of the way there, but really a lot of the work is going to be shouldered by this group as well as the board going forward to make sure that we do deliver on what the board asked us to do. So in terms of kind of what's been going on for the past 3.5 or 4 years, frankly, a lot of listening, a lot of asking questions, a lot of talking to folks, and a lot of listening to what folks have to say. Obviously, most recent, and the thing, we've had many people around the table that have been involved in these ad hoc committees. But we've had advisory committees, both technical and citizen advisory committees, a series of idea exchanges in this room to gather input on key issues. Surveys to local government staff on a variety of issues, including a focus on urban centers, but also we also looked at rural town centers, which are an important part of MetroVision as well. We created online tools to gather feedback from the public. A series of listening sessions that target not only the public but also key stakeholders from around the region, and then periodic sort of interim deliverables such as the issue report that I mentioned previously, or the regional housing strategy, or the companion document, the regional economic strategy. So a lot of sort of work in the intervening time before kind of beginning to put this information in front of the board. So as I mentioned, we're here mostly to talk about these 2 sort of new issues today. On housing, just the housing strategy, which you have the executive summary, really is just the starting point of the conversation. It's one piece of information. There was a lot of stakeholder input and data analysis that went into preparing that document, but I can guarantee you housing has been something that has come up in almost every conversation we've had regarding MetroVision. And obviously we have an ad hoc group that met 4 times to actually develop the policy framework that's in front of you this evening. And then on the community health and wellness side, we had an idea exchange, like I mentioned, did develop an issue paper that was distributed to the board back about 9 months or so ago, provided a quick update to MVIC back in June, but have really had a lot of engagement from some stakeholders interested in the issue of community health and wellness throughout the process, and that's really kind of how we ended up where we are today. So talking first about sort of the community health and wellness side of things, the reason I oftentimes kind of say new in air quotes into whether this is a new section or not, MetroVision in many ways has talked about health for quite some time. It just maybe hasn't been as front and center as our stakeholders are suggesting it should be now. For instance, in the last version of the plan that the board adopted, there wasn't a separate section that focused on health. There were really no direct goals, but it was there was a lot of connections to health in the transportation section and community design in places like that. So in many ways, we were talking about health with maybe not talking about it kind of above the fold. It wasn't necessarily a front page sort of issue, but that's one of the things that we've heard consistently through our engagement efforts is that we should begin to go down that path to really further illuminate this issue at the regional level. So some of you may have seen these slides before at the update that we gave back in, I guess it was June or so I'm going to go through them quickly. But this really kind of reflects some of the things that we learned in that issue paper that I mentioned. I will talk about challenges related to the issue of health, but I think it's important to say that there's actually a lot of successes that are going on in this region as well. A really strong network of folks around the region that are focusing on health. That's one of the reasons that this sort of bubbled up to the surface for us. And another reason is that, frankly, at the local level, this issue is gaining a significant amount of attention. We've often described that this is an opportunity for MetroVision to simply catch up with what's happening at the local level. We have lots of local communities that are really trying to integrate health into many more of the things that they're working on, and maybe the region should reflect that as well. So on the challenges side, obviously as a state in our region, we're oftentimes thought of as a healthy region and a healthy state, but the reality is that there are disparities around our region. Really, it oftentimes comes down to education, income, and race. There are just disparities and observed health outcomes based on those variables, and so that's just the reality of what we see in this region. So yes, the headline might be that we're very healthy, but there's some subtext there that's important to understand. Issue of access to care has been something that has come up quite a bit. Actually, going back to 2013, when the board had their workshop back in February of 2013, we asked a series of questions to talk about local issues that you really think may actually really be regional in nature, and access to care was one of those issues that the board really narrowed in on. And we're also observing through that issue paper kind of a growing divide. We have some communities that are really focusing on health, which is great news, but that also means that there are other communities that maybe are not doing as much. And so will that ultimately further the divide going forward?
Mayor Rakowski is asking if we want to take questions now. I think what I'd prefer is, since we have this in two distinct groupings, there will be a pause between the next piece of it. So if we could hold our questions till the pause, that'd be great.
Thank you.
Thank you, Mayor.
We also have heard quite a bit about sort of the simple issue of people having difficulty accessing healthy food for any number of reasons. But this is also something that is continuing to be something that our local communities are really focusing on. Nearly half, or even more than half, of the communities that responded to the local government survey, this is an area of emphasis for them to make sure that their residents have access to healthy food. And also, obviously, you know, the land use and transportation patterns that our region has can sometimes lead to making it difficult for people to make healthy choices. And that's really what we've heard consistently through this process, is that should be the goal, is to make the healthy choice as easy of a choice as possible. Some other challenges, you know, as I mentioned, lots of energy at the local level thinking through this issue. But those that are really focusing on the issue of thinking about community health and wellness are running into some real barriers. Going back and retrofitting is not the easiest thing. You may say that you want to do certain things, but when you actually go to try to implement them, they become very difficult to do. The easiest one to think about is you may have a street that is, you know, curb to curb, simply just a roadway facility, that there's a desire to add pedestrian, bicycle, or other amenities to ultimately add more active transportation issues, but the right-of-way and the cost make that really difficult to do. We also heard, particularly during the idea exchange, that there's actually quite a bit of interest from the private sector to begin to think about health amenities and their programming as they're thinking through developments. And that it really is becoming a selling point. They can actually draw a premium by having a really sort of an understanding or a perception that their development maybe is really focused on health. But they do run into barriers with local regulations to ultimately do some of the programming that they're trying to accomplish. So, you know, there's energy here, but really some of the follow through is falling a little bit short. Another key challenge, for the first bullet, the changing healthcare delivery system, I think the easiest way for me to say this is that healthcare as an industry, both how healthcare is provided, but also the footprint of that industry is changing so fast that it is just a massive moving target that's really difficult to keep up with. I mean, I think we can all recognize just facilities moving around our region or expanding campuses or changing locations is happening very quickly. So how can we grapple with this and ultimately respond in some way? And then obviously the environment that surrounds an individual obviously has a really big impact on their individual health as well. I think we can all relate to sort of the air quality challenges that might impact someone's individual health. So that's sort of the gist of kind of the conversations that we had on this issue. So a little bit about how ultimately MetroVision might respond on this issue. We've largely heard that there are sort of two key things that we need to do. The plan should continue to connect those dots. It should understand how health and transportation are connected. It should continue to understand and reflect how the region's natural environment really does impact individual health. It should understand the economic impact, that one of the selling points that we have as a region is that we are a really healthy region. Workers are less likely to miss days here, maybe work days than they are in other places, and that's actually a real driver for people that are making decisions as to whether they want to locate a business here. In addition to doing that, we should also really, as I mentioned, kind of amplify the emphasis on this issue, really focusing on kind of three key things. That healthy food issue, making sure that our residents have access to healthy food, and then that the healthcare facilities and services that are out there, that people do have access to those amenities, and then leveraging that really emerging and strong set of networks and resources that we have on this issue to ultimately its fullest extent possible. So I'm going to walk you through kind of where, as I mentioned, kind of the stakeholder and technical folks ended up in terms of what outcomes and objectives the board ought to be thinking about as MetroVision moves forward. So really kind of one key outcome that has been identified is thinking about a built environment that supports healthy and active lifestyles. And so that's sort of the thought of what ultimately this region should desire to be in the future, and some of the ways that we would get there are the things that you see below that. So let's think about convenient and safe mobility options. Mobility may go up in an area, but if it's not safe, you ultimately aren't having health outcomes, right? If you were seeing more traffic fatalities, you aren't necessarily resulting in a healthy place. Again, healthy access to healthy and local food, as I mentioned, and then one of the things that is really a key amenity in this region that we've heard consistently throughout this process is sort of our recreational and natural environment. But it's only as good as the access that people have to that, and that's a way to be thinking about health in a lot of ways, is to ultimately make sure people have the access to those amenities to take advantage of them. And then the other sort of side, the other outcome that ultimately stakeholders landed on is that, again, this access to the health services that we do have. And the first objective is pretty simple, making sure that we understand that the connections that need to be made to those health services. And then really it's about awareness and having the ability to ultimately connect to those networks that I mentioned. There's a lot of conversation out there that we just simply aren't taking advantage of the networks that we do have, and it's simply just an awareness and a visibility issue, and that there are a lot of supports that could ultimately result in positive health outcomes if we just simply took advantages of the resources that are already around the table. So in terms of some key strategies that have been identified, in terms of sort of healthy and active lifestyle choices, and I'll just sort of hit a few of these. First and final mile connections, obviously that has come up throughout the process, but it really has come up on the health side of things as well, to make sure that we, as we try to build off the investments in particular that we've made with transit, that we are creating those connections that allow people to take advantage of that resource. And then thinking about things like complete streets, that as we think about making connections between places, that we're thinking about connecting all modes through that process. Continued sort of a similar set of strategies. We can produce and process all the healthy food that we want in the world, but if we don't have a distribution system that puts it in front of people, it really doesn't do as much good as it could. And so we should also be thinking about food distribution. We heard quite a bit about sort of thinking about access to the regional trail network. That's one of the things that this region has in spades, is a huge amenity, and we need to make sure that we're taking advantage of that, because it is something that people can access and use both for utility, home to work trips, but also for recreational trips, both of which ultimately have positive health benefits. And then making sure that we also understand that as we grow our transit system, think about how it can connect people to those recreational opportunities as well. Last few on the health side of things. So some strategies related to kind of connecting folks to the health services that we have. Sort of two approaches here. Think about locating health services where they're needed, and then obviously make sure that we have accessibility to connect people to the health services that are kind of on the ground. I think that makes intuitive sense. And then some additional strategies. It really kind of comes down to what I mentioned before, that really we do have a really broad network of folks that really are focused in on the issue of healthy places. And so let's just make sure that we're taking full advantage of those support services. And that's sort of the fire hose version of really what we've heard from the stakeholder and analysis side on the issue of community health and wellness, and a preview of really what the board will be deliberating on relative to that issue. So happy to take questions on this section now.
So questions and comments. Mayor Rakowski.
We have a unique situation where 3 of our counties, Adams, Douglas, and Arapahoe, are all served by the same health department, which is great. So do we have connectivity with Denver Health? I think Boulder has their own health department as a county, and so that pretty much covers most of the, and Jeffco would be the other one. So do we have a good communication with those? That's number one question.
So just so those groups regularly meet and have a really good relationship. We have just now to sort of begun to be at that table. I mean, and part of it is, I will tell you, I almost need support from the board to get too much further down that road. If ultimately you don't feel like this is an issue that we should be working on that's important to you, then I can only engage so much. But we have already begun conversations, particularly kind of related to data. We've demoed, for instance, the Regional Equity Atlas to those groups as a way to sort of share some health-related data. So the conversations have begun, but they're definitely in their infancy stages.
And the other next item that I didn't see covered, which I was disappointed, is a very major public health issue called suicide. Right now, for the last year, for the records that are available, it's up 16%, and within the metro area, the Tri-County Health area, particularly Douglas and Arapahoe, have among the highest suicide rates in the state. And the third leading cause of death between 15 to 24-year-olds is suicide. And we just had a tragic happening at Arapahoe High School this past weekend, or weekend before. And so there's one. And then the last item that I didn't see any connection with is addiction. And that is a real public health issue because it ties back into crime. And right now, I don't see my good friend Herb Atchison from Westminster, who recently had 2 heroin overdose deaths, and I can tell you right now that heroin is a real issue in the metro area. The south side has its problems particularly, and that's partly because OxyContin is $40 a pill on the black market. Heroin's $5 to $8 a bag. These are major public health issues, and I mean what you raised were good items, but they're the feel-good, nice, we can talk about it in open society. We don't want to talk about what I just brought up because it's dirty linen, and I think that lack of discussion helps foster the issue. And I think the more discussion we have, the better off we'll be in that regard. End of sermon.
Other questions? Councilmember Paplas.
So it's more of a comment. I just wanted to express my support for this community health and wellness effort. I think that it's really important. I think we're going to find that it actually ties into a lot of our MetroVision goals already, that to make it an above-the-fold issue and to really articulate and consciously think about this, to me, makes a lot of sense. I mean, because I think that we can do a lot of things with this. It will help economic vitality. We'll have healthier folks living here, and I think the focus on prevention, whether that's through planning or healthy foods or whatever, I'd love to see us do that so we don't have to have as much need for access. But if we do need access, that's also an important piece, the access to health care. So I think that this should really, this discussion can help to inform a lot of what we do in MetroVision, and I do think it'll dovetail nicely with a lot of what we already have existing in our MetroVision goals. But to see it kind of consciously brought out, I think will be a really important thing. So I would love to see us really pursue this.
Mayor Cernenek.
Yes. Thanks, Brad, for this. I'll probably pile on a little bit at this point in time as to at least my sense of gaps that aren't addressed here. Not only do we have suicide, but as a general place, the issue of mental health is not addressed, and it's a concern across all ages. And how does that, it goes everywhere from the schools to seniors. I think that's an okay thing to say. The other is, this highlights our image of ourselves as active, but we know from the studies and demographic information for the Area Agency on Aging, which is part of DRCOG, is what are we doing with regard as we become frail, and whether that gets included in health or not. I think if we don't have something like that and recognize that the changing demographic, that would be a question. And then my third piece, which highlights the others, is I understand how it may fit in with the regional planning part of what we do, but also what is not necessarily the DRCOG execution point of this, but then what are the DRCOG execution points, so that if we come through this, it may be regional considerations. And some of these, as Mayor Rakowski mentioned, we do have Tri-County where we are. How much of it overlaps with what should be done with some of those organizations themselves?
Commissioner Jones.
Thanks. Yeah, appreciate the presentation, Brad, and I too tend to agree with Tim Plass's comments about how it makes total sense and already fits well with the MetroVision we've been having in place for years. One place where I think that connect the dots could even be stronger, you talk about complete streets, but often we think about the transportation facilities on streets. A vibrant land use pattern also facilitates walking and being active and using and being choosing a form of transportation and lifestyle that's more active. So, and that's everything. So in the land use arena, that can be how big the blocks are, whether or not you have mixed use, whether you have a vibrant nightlife where people want to be on the streets because there's something exciting happening, whether or not they feel safe because it's lit and other people are there. But it's less about transportation in some respects and more about the land use pattern, which I think fits well in with other MetroVision goals we have. But that connect the dots isn't as strong as it could be, I think, on that one.
Thank you. Mayor Pro Tem Millay.
Even though Bob tried to keep the mic away from me. And I guess I want to follow up kind of on some of the connection issues that Elise just raised. If we look at the policy framework, we're kind of using MetroVision as a guide for our decision making and serving as a call to action. And I think I go back to some of the comments that started the presentation off, that a lot of us are doing this already in our cities, and this is DRCOG's opportunity to catch up. And I guess in a visioning process, I completely understand our role in kind of presenting this community health and wellness as an important regional vision. But as a call to action and guiding our decisions, I just wonder what decisions DRCOG is going to be making that are really going to be serving as a call to action. And I definitely see the connections to transportation and access to healthy food, making sure we've got a vibrant system that's allows freight to be transported efficiently throughout our region. I didn't see any of that discussion in here. I think getting food from the processing plants to the communities, again, going back to the freight issue, I think providing access to and any kind of access, I completely agree with the idea regarding land use, but to our trail recreation facilities and our healthcare facilities and the complete streets. And I see the land use and I see the transportation as a real call to action for us to look at and to help us guide decisions. But I really start to question really our ability to impact some of these other very, very important community health issues that are being raised. One of the things I didn't hear was any discussion about every indication is that our air quality standards are going to be becoming lower, and we're not even meeting our current standards, let alone and I don't see anything in any of this discussion that addresses these very vital, important issues that I feel like there's so much that we have yet to do to the best of our ability. The idea of expanding this envelope into areas that are, while extremely important, I don't see us guiding decisions and serving as call to action and diluting the time frame that DRCOG staff, given our current budgets, have allowed to move into some of these very, very critical, important areas unless we have some additional funding that I just don't see coming. We all sat through the TIP process and had very, very worthwhile projects that were not funded. And I think that could make impacts on providing access to recreation, to trails, to hospitals, to recreation centers, which I think to the older folks in our community, getting them there for the programming that's taking place there in inclement weather, and I mean all of these other things that I think we have a role to play that we already know about and can kind of address. I just am very, very concerned about what our call to action and the decisions will be guiding with some of the information that's being presented.
Councilmember Teal.
Thank you, Mr. Chairman. I'm glad I'm following Jackie because on one hand, when I think of Castle Rock and I think of this subject, I think of a community that would probably do very well if we do proceed down the course of integrating this topic in as a call to action. We have 6 hospitals in Castle Rock, one of which actually focuses on the species called Homo sapiens. The other 5, they've been there for a long time. But the bottom line is, again, Castle Rock, we have this focus. We have a major commercial development going in, and Whole Foods is going to be one of our anchor stores. Yet at the same token, those are decisions that we have made as a town. That's a direction we have made as chose to go as a town. I'm a little concerned that we're getting into an area that, as a recent conversation said, is front yard versus backyard. We're getting into an area that is really the backyard issue of a community, and I just question the regional focus of this topic and whether that is really appropriate. At the same token, at a very selfish note, I can see a lot of ways that if we do integrate this into our TIP process, we integrate this into our funding process, Castle Rock can benefit. So I'm interested in hearing more. I would certainly be interested in seeing a discussion on this topic over the next few months. I guess I'm just a little doubting if it is appropriate as a regional issue.
Councilmember Kinich.
Thank you, Mr. Chair. I was, as Jackie was talking, I was thinking I really agree with some of the framing, and for me, I'm thinking about this in kind of buckets, which is that there's really 3 things in my oversimplification that the plan does, which is one, it's kind of a bully pulpit or a visioning document that I think is really just about calling attention to things. And so, for example, I really do support the inclusion of mental health as one of those themes, because it is, I mean, clearly underfunded. The state is trying to tackle it, and so I think us weighing in with the bully pulpit of the vision plan is appropriate. I think then there's a second bucket, which is the things that are a regional call to action for the MPO. And then the third is, you know, here are good ideas that we want to help, you know, provide technical assistance or best practices to local jurisdictions, right? So all three of those things are in the plan, and I think different pieces of the health fit better in different buckets, but to me there's a place for everything that's been talked about. And so, for example, I think it's totally appropriate to prioritize the regional MPO call to action to the things that are closest to us. And so I do agree completely that the air quality is a really obvious one. And so to me, because we don't care about air quality because the feds have a standard. I mean, we care about it because it's bad for people to breathe dirty air, right? You know, so I think it makes a lot of sense to keep, you know, the calls to action for the MPO closer to the things we have jurisdiction over. And then there's that second bucket, which is, for example, grocery stores may not be the MPO's work per se, but it could be the technical assistance we provide in best practices, right? So it may not be that there's any tip points for access to a grocery store, but it might be that when we go about doing our charrettes on the best practices for urban centers, that we encourage folks to think about health facilities in them, right? So to me, I actually think we can kind of get to some of the concerns George has raised and the suggestions that Jackie had by just remembering those three buckets and thinking that some things are a better fit for each one. But I don't know. For me, I kind of think that we can get there by sorting out the buckets a little bit, and grocery stores might be more the local one, but air quality more the regional one. So anyway, I think this is a very workable section, and I think we'll have the similar conversation on the next one. So just kind of thinking about different stuff in different buckets.
Commissioner Partridge.
Very good. I'm going to use some of my old profession on some of the analogies here, because I think we're just kind of in a brainstorming session here, because as a physical therapist in athletic training, you certainly deal with musculoskeletal, nervous, endocrine system. So I see that we have all systems, just as we look at it from the whole region. Everything we deal with, we look at all different types of system. And as we know, is whether it's land planning, whether it's transportation, area and agency and council, or aging, we see all these parts and many other parts that come into play. But it doesn't, but I really focus on some of the comments by the mayors too, that this gets more involved, because we know when it comes to those things. I added to those communicable diseases for STDs, Ebola. When you start talking about health, you just look at those systems you talk about in the body. That gets very, very complicated. So I think we're diving into an area that we haven't even touched the surface on when we explore that. I certainly agree with Mayor Pro Tem Lone Tree regarding the questions, and I appreciate that, Robin, talking about the bully pulpit, kind of bringing all these things to the forefront. Kind of reminds me of my lovely wife, very creative person. I love sitting there having coffee with her, and she just starts to brainstorm about things in the house. We could do this, we could do this, and we live on acreage, so it doesn't just go inside the house. And then I asked her the question, how are you going to pay for it? So, of course, she says, why kill the conversation? But that really comes down to it. Was the question asked in any of these discussions, stakeholder events, anytime, how do you suggest we fund this? Where's the revenue source? And I mean a serious discussion on that. Because it always, you know, Commissioner Hilbert always said, if you want a seat at the table, you know, if you better be at have a seat at the table, or you're going to be in the menu. I also say, if you want to be invited for dinner, you better bring your checkbook sometimes too, because you've got to be there because that's serious. It is. How are we going to fund it? Because as we know, the funding sources are difficult. Also, what's going to be the fiscal impact on DRCOG? We already know there's a challenge on everybody's staff. So I would like to see a breakdown when any of this that we're looking at, whether it's economic vitality, whether it's housing, what is that demand on hours? What is that demand, that true fiscal impact on staff and on dollars and cents and staff demand numbers? So I think really when we look at it, is it a call to action or is it a call to awareness?
Councilmember Pfeiffer.
Well, so I look at, coming from our city, we don't have any hospitals, so we're not as lucky as Castle Rock. We actually have to go to everyone else's community for a hospital. But so I'm interested in looking at this maybe a little bit differently, more in the aspect of a dovetailing into what we do as our core business anyways. Some of the challenges we have within our community is, of course, the food deserts, grocery stores as well. But it's not, can you drive there? It's, can you walk there and trail? So I think there's a way to correlate what we're trying to achieve here to what our core tip processes and missions are. I mean, trails, and maybe you added into how accessible are you to grocery stores. But I want to add food banks. I'm very passionate about food banks because there are some food banks that are not accessible by commuter rail, bus, and maybe even not even a bike trail. So we've got to look at this a little bit broader, and then encourage folks that may not have a vehicle to get somewhere, which is fine, but be able to access those food deserts and food banks. I also, I think we are the largest silver tsunami in Jefferson County. It is in Arvada, and for us, we do a lot with the Resource Center. I think we need to explore how do we get our aging population to where for mental health or for their doctor's appointment. I do think that is a serious issue, and we need to explore expanding that support of our aging population to recreational facilities and to their doctor's appointments and so forth, so on. I know we do a little, but I think we can do more. So if we take what we're talking here and then maybe correlate it to what we do as our core mission, I think there's a lot of relationship to it already. We just need to relate them.
Councilmember Quinn.
Thank you. Not to be redundant, I just wanted to go back to the fact that we had an idea exchange right here in this room back in November on health impact assessments. And I think it's important to understand that best practices, technical expertise are important things. I didn't know very much about health impact assessments until I sat through that session. So I think being able to provide that is also an important component of this. Thank you.
Mayor Noon.
I do appreciate having the discussions, having the awareness, sharing what we're all doing, but I am a little bit concerned about how much goes into our MetroVision plan, and that, and Robin, I apologize, but if it's going to be used as a bully pulpit, and now that's also our criteria, I guess I don't think as a criteria for projects getting money should be a document that we're going to call a bully pulpit. So that makes me a little nervous. Now, that said, I've been on the aging advisory since, I think, '06. So I've been doing this long before I was ever here. And we have aging dollars, and we spend those aging dollars on aging. None of that funding shows up in our TIP criteria, as our pool of money that goes out to TIP. So I look at what we do by our funding sources quite a bit. So if we're getting the money that we spend because it's transportation money, then it probably needs to be focused on the transportation. And I would be a little bit concerned if we get too far off target, because we do have health departments and other organizations that are funded to do those duties. So I'm a little concerned about us we are really spreading that peanut butter thin as far as what our job is, and our funding source is very defined. And so I thought our mission was to, if we're going to work on air quality, we could probably spend all our money on air quality. If we're going to work on transit, it could be all, there just isn't that much. So I think there's an awareness factor, but I'm so nervous when meeting the MetroVision goals is a large part of phase 1 criteria, and now it's going to be based on a document that we're just making a statement. So that makes me a little nervous.
Mayor Pro Tem Malay, before you have a second bite, let's see if there's anybody that hasn't spoken that would like to. Mayor Pro Tem Malay.
And I guess based on kind of what I'm hearing at the table is that I think the dovetail back to the transportation system, providing the access to, I think the freight mobility to me is a huge issue. I think dealing with the air quality issue is certainly a community health and wellness issue, and I think providing access to healthcare systems. We actually, now I'm going to brag, Lone Tree have 2 hospitals that are accessible by light rail. Right now, one of the hospitals, we are paying for a shuttle service to allow it to happen. I mean, it is something, you know, to the backyard, front yard, we are prioritizing that within our community, and it's being done. And I guess part of me questions, you know, if technical assistance from DRCOG, while I'm sure could help a number of communities, is that the best way for us to spend our transportation planning dollars? Because that is the funding that we do have. So to me, I see if we can make these links to getting people to mental health facilities, recreation facilities, food banks, trails, healthcare systems, I think all of that with our transportation lens makes the most sense. A robust, efficient transportation system will help everyone and hopefully improve air quality as well and give people, you know, opportunities to get out and exercise and get to places where they can. So I guess that was my closing comment.
Councilmember Kniech.
Thank you. And I just to respond really quickly, I think I'm a little nervous that the over-focus on TIP, because there is no other entity that does any planning for the region, and we are not just charged with transportation planning. We are charged with a comprehensive plan. And for example, we are the area agency on aging, and we actually spend money on health for seniors. We spend money on transporting them, right, to health appointments. And so to me, it's totally appropriate that the regional plan be comprehensive. To start to say that we shouldn't put anything in there that doesn't tie directly back to transportation assumes that someone else then is going to describe that in some other regional plan. So I just get very nervous about the idea that what we're creating is a document that is a precursor to the TIP criteria. We are, in my opinion, and my understanding of the federal rules and is that much broader. So I just don't want us to be like saying everything in this plan must tie back to TIP criteria or transportation. I just think that would be a little bit too broad. The second point that I just wanted to make is that I think that the idea that we should be looking at like what the staffing requirement is for something in the vision plan, we don't do that in any other area of MetroVision. I mean, there's plenty of things in MetroVision that are aspirational. We talk about access to open space and the importance of that in terms of a livable region and growth. We don't ask for a staff breakdown on how many hours they're going to spend on any other section of MetroVision. So it's a little odd to me to suggest that we should do that for these sections when we don't do that for other things in the plan. So I mean, if folks were to look back at it, I think we would see that there's a number of sections that, like this one, are very aspirational and broader than just what we do on transportation. I mean, there's things in there about environmental sustainability or like I don't know if it's brownfields, but we have a section on infill. I mean, there are a lot of aspirational pieces. So if the word bully pulpit kind of rubs folks wrong, I get that, but maybe the better word is aspirational. We don't work on every single line item in the plan now, and I don't think we'll work on every single line item in the plan when it's revised. So I want to broaden our conversation a little bit, I think.
The executive director has a comment.
Yeah, I just wanted to clarify or follow up on what Robin was saying. The federal responsibility is broader than just transportation. There's environmental impact in there. There's planning for the current population and what you know the population is going to be looking like over 20 years, and where people live, where jobs are, all lots of different things. But it's also appropriate to have some concern about TIP criteria being tied back to MetroVision, because that is the history of some of what's in there. So I just, especially for people that are a little bit newer on the board, I just want to just say that both those things are accurate.
Mayor Horn.
So I did just want to mention that I think we do some other things here at DRCOG that don't always include money. Land use planning is one, and we'll probably get involved with that this summer. And not that we dictate to communities land use planning, but that's one of the areas that I think is very, very much involved in this health and wellness and how we do that planning. So I would throw out that there are some things that I think aren't financial, but we can share best practices. We can, as we plan our expansion in land use, as more people move to this area, keep some of these things in mind.
Commissioner Partridge.
Certainly great comments, and I think maybe this is an education time for us, and I've certainly gone through this a lot with some of Dr. Cog's staff and our staff, and as I understand it, and some of us have been on planning commissions, and as we know it in our areas, our planning commission creates our master plan. And our master plan is a guiding document. It is a vision. So I support that. And it's that we are. And really, as I understand it, that's what MetroVision is. It's our guiding document. It's a vision. But where I am cautious about is to make sure that this doesn't turn into policy. That's our TIP program. But our guiding document does give us an indication what is our policy, our TIP. So that's why I certainly don't disagree at all that we don't have a call to awareness of all these issues. But a call to action is our TIP policy, our TIP plan, our actual policy guiding, defining document. So I think there's a real difference for us to really understand and ask those questions more. What is MetroVision? Where's our policy document?
Mayor Pro Tem Millay.
The only thing I wanted to point out also is that we are talking about it kind of expanding our MetroVision, and I think we need to think about the consequences of expanding MetroVision. And, you know, Brad indicated, you know, no, he doesn't go to the health department meetings, and to do that it would require direction from us. Well, I guess what I need to make sure I'm comfortable with is that us including something like this isn't giving direction for staff to then go to start attending health department meetings, because I feel like I think we can have an impact on this through the transportation planning monies that we do have, and I want to make sure that we're doing our transportation planning in a way that's going to be beneficially impacting the community health and wellness in the region, and that's the priority as far as I'm concerned, unless we get some additional funding from somewhere else. So I realize we work on things that we don't get funding for, but I think we need to be very careful when we do that, and really consciously make the choice that that's what we're going to be doing. And so that's where I was coming from.
Commissioner Jones.
I think in some respects we're not necessarily disagreeing on some of this. A vision document should be aspirational and have visions, and where you get to the part about where the rubber meets the road and giving direction to staff on implementation, we have to be precise and make sure that we're mindful of not spreading staff too thin. But I do want to make sure that we don't start by going directly to direction to staff. I want us to at least spend some time in the vision piece, because I think it's really important. This is the table where we think as a region, and I don't think there is another table that is as broad in this. And this is the collective painting of what all of our communities, when we come together, see for our region, and connecting the dots between land use and transportation and air quality and protecting the environment and having a robust economy, and how those all fit together. And it should be something that the local governments in our region can open up to and say, yeah, that makes sense. You know, how my local government implements this will have a different flavor, because it's, you know, we're unique and different, but we buy into that vision and we understand how it all fits together. And we can, when we interact with staff and they're talking about best practices, those relate directly to the vision, and I think that makes sense. So I think we are needing to be mindful of both ends of the spectrum, but make sure that we leave some space for the visioning piece of it, because I think when we start MetroVision, you know, that's really the first entree, and then eventually we'll figure out how it gets implemented on the ground.
And with that as a segue, I just wanted to mention that if you look on page 15 of this presentation, the last page, it does say that MVIC and board will continue deliberation over the coming months. So we're going to have more opportunity to talk about this. I don't want to cut off discussion now, but I just wanted to point out that we will have lots more opportunity to talk about this. Mr. Graves?
Thank you, Mr. Chairman. I'll be brief. First, I agree that I don't think that we're that far apart. I'm just hearing kind of messages of concern as we do planning. I want to really underscore the importance of access to care and healthcare delivery systems, and I do think that's something that dovetails into our mission around transportation infrastructure and other things. I think whether you're an urban community at the core or you are a suburban or rural community, access to care, things like clinic systems and other things beyond the main hospital campus are critically important for each of our constituents. And so I really just wanted to say that that's a very important piece of this piece.
Other comments or questions? Okay, thank you very much. We'll move on to the housing piece, Mr. Calvert.
All right, thank you. I'll try to do fire hose version 2 so that there's time for additional conversation after this. So much like I did with the sort of the community health and wellness piece, again, you know, for ease of description, I often describe the emphasis or priority of thinking around housing as new, but in some ways that's really not necessarily a fair characterization. The current MetroVision does have a focus on housing. We've had a long-standing goal to increase density in this region since really the very first MetroVision, and that density is ultimately about housing density. We do have, the last time the board adopted MetroVision, they included a new goal to accommodate 50% of new housing units within designated urban centers. There's a series of sort of policy guides within MetroVision related to, you know, making sure that there's a wide range of incomes and abilities that can be accommodated by housing within urban centers. There's a very strong emphasis on the issue of housing and how it connects to the issue of older adults. The board sort of migrated from a senior-friendly kind of focus to a broader thinking about community design, but housing has always been a really key part of that. Other key concepts from MetroVision 2035 is thinking about having communities that can accommodate all ages, incomes, and abilities. And obviously accommodation, you know, housing is a pretty critical part of that. And that ultimately we do have communities that can respond to those changing demographics. And obviously that connection to housing and having a compact urban footprint is obviously pretty critical as well. So just a little bit, I'll do a little bit of background on this issue. As I mentioned briefly earlier, which now seems like quite a while ago, so I'll say it again. You know, back in 2013, we had a conversation with the board at your workshop, and really kind of worked through a conversation of tell us a little bit about what's going on locally. What are some key local issues that you're wrestling with? And of those, what feel like they maybe need regional attention in some ways? And housing was one of the things. There were basically nine areas that the board at that time identified as sort of fitting that criteria, and housing was one of those. And I'll talk a little bit more about some of that direction here in a second. As I mentioned, we did develop what was called a regional housing strategy, and actually this group, this body, MVIC, actually gave direct guidance to staff about the scope of that work back in now June of 2013, and that is what the executive summary of that report is in your packet, and that was developed by a consulting firm, BBC Research and Consulting was hired to complete that work. So just to kind of, again, go back a few years in terms of what we heard from the board in early 2013, it's just this notion that a lot of communities were struggling with lack of variety of housing stock, including an appropriate mix of rental product. A lot of folks were struggling with housing stock that simply isn't meeting the changing needs of that community. They're witnessing the sort of the types of households and the people in their community changing, but they aren't seeing the housing that can keep up with that. And that is particularly true with the issue of the ability of older adults to remain in their home and their community that they choose to live in, that they simply don't have the options in their immediate community, and that many communities were struggling with really public resistance to infill and redevelopment. That was a priority area for growth in a local community, but simply it was very difficult to actually accommodate development in those sorts of places that may be seen as being too dense or too particularly height issues in certain areas. So a little bit about I'll walk you through kind of what MVIC told us back in June. We sort of laid out where the strategy was going, but we specifically wanted you all to kind of chime in to help us understand how to kind of draft the most appropriate scope to shape the study. So one of the concerns that this group asked staff at the time was, will this study ultimately result in understanding or documenting individual community housing needs? And the answer to that is no. And it was no then, and it's still no. This was really about kind of the regional picture related to housing. Most of the data gets reported at the county level, and really nothing below that. This group directed us to think about housing as a connective issue. The issue itself is important, but also understand how it connects to all the other things that we do, sort of the dovetailing conversation that you just had on the issue of health. And so we definitely wanted to reflect that in the work that BBC worked on. One of the questions that was asked was, will this work ultimately understand kind of the dynamic of socioeconomic change in this region, particularly sort of how poverty is shifting around the region? And yes, that was something that the study did focus on. And then another question that came up at NVIC back in June of 2013 was this issue that a lot of communities are dealing with, particularly those that are watching rail infrastructure begin to come out of the ground, is the competition for land between manufacturing and industrial areas and housing. And would the strategy look at that? And the answer at the time was really no. That's too sort of sub-market or market-based, and we weren't going to have the ability to get to that deep of a dive. But using some resources from the Sustainable Communities Initiative, that was something that was looked at in a couple of corridors, and it's actually just kind of works out that the board will hear about some of those projects at your meeting later this month. Particularly, these issues in particular were really front and center along the Gold Corridor and work along the East Corridor as well. So a little bit about the housing strategy, again, executive summary in your packet. Very much the starting point. It is just one piece of information. I mean, I tried to make that very clear to the ad hoc committee. Yes, great. We paid for a consultant to do this work, but bring your own knowledge to the table. As I mentioned, this conversation about housing was ultimately infiltrated almost every single conversation we had about the future of this region. It was just very top of mind for many people over the last couple of years, so it wasn't necessarily something we heard exclusively when talking about the housing strategy. And one of the things that the strategy does do is it talks about potential roles, responsibility, and policies and actions for DRCOG. And then, obviously the bigger question is should this issue be integrated, and if so, how, into MetroVision? And obviously that's a decision for the board of directors. So the housing ad hoc group met 4 times, September through November. 18 communities signed up. This was a sort of a self-selected group. Obviously, one of the things that we think about when we have committees like this is this representative of the broader region? And the 18 folks that volunteered, when we looked at the list, we're like, this is actually a pretty good list. Let's just sort of keep it as it is. And so that's really what we did. So obviously a pretty broad cross-section of communities from around the region participated in this conversation. So as I mentioned, obviously we focused on the housing strategy, but we did lots of other things as well, and some of this is a little repetitive, what I mentioned previously, but the listening tour, as I mentioned, was done maybe 3 years or so ago. Lots of conversations about housing in the local government survey, which I'll mention here in a second. We did a series of focus groups with a variety of folks, but for instance, we met with the Denver Association of Realtors to talk about sort of what their experiences are. Lots of one-on-one and focus group meetings with local staff, both housing authorities as well as local planning staff or other staff that are maybe associated with their entitlement work because they receive direct allocations of funding through HUD. The regional economic strategy, which we always viewed as kind of a companion piece to this. Housing just sort of organically came to light in that conversation as well. As I mentioned, we've done some online tools as well, and housing was a key area of focus in some of our meetings associated with the Sustainable Communities Initiative Consortium and symposium meetings. So I'm going to quickly just sort of hit a few of those highlights, again, kind of sharing kind of things that we heard along the way. In terms of the local government survey, this is something that we did now summer of 2013, and housing was a really key issue that came up during that process. These were largely planning directors and equivalent folks ultimately filled out these surveys. When we asked what housing priorities do you see in your community, affordable housing just came up over and over and over again. So you can kind of see that over here. But frankly, there were other housing types that came up as well. We have other communities that are simply trying to add executive housing to their portfolio. They may feel from a subsidized or market rate affordable standpoint, they actually have a pretty good inventory and they're trying to fill out their overall portfolio. We also heard obviously a lot about challenges accommodating older adults and the current housing stock within communities. And just to give you a sense, my sense when the local government survey results came in, I thought this was a pretty good cross-section of communities. It was about 27 communities responded, 6 counties, 21 municipalities, ranging in size from 600 to 600,000. So we had a pretty good cross-section of folks, many of which kind of landed in pretty similar places. In terms of gaps that they may have identified in terms of housing, senior housing, just number one with a bullet, was something that folks really just sort of saw as a really critical need in their communities that they are having trouble filling those needs. But you can see that was not the only issue as well. Lots of folks sort of relating to the issue of trying to build attached for sale product. affordable housing, particularly on the market rate side, were things that people just saw as really critical gaps in their communities that they need to figure out how to fill over time. As I mentioned, the issue of older adults in housing came up pretty consistently. I mean, it was a universal when talking to housing stakeholders that we have got to figure out housing issues for older adults. You know, I hate to throw around this term, but people were talking about we have a crisis when it comes to housing needs for older adults. There's just no other way to describe it. As the Area Agency on Aging, we have people that call here all the time on the brink of being evicted that we have no place to put them. And it is, the call volume on that has picked up, I mean, dramatically over the last 9 months to a year. And we also have issues where we heard consistently that a lot of seniors looking to downsize and to stay in their community simply don't have the option. They either can't afford it or there aren't the product that they're looking for to ultimately stay in their community of choice, and that's a really key challenge. As I mentioned, there were some connections to kind of the economic development or economic vitality side of this. So these really came out of interviews with economic development professionals. In general, they thought that wage earners and the sort of middle and upper wage jobs actually have pretty good housing options across the region. But sort of going back to the previous comment about the local government survey, but obviously at different communities, people are seeing that they would like to have more executive housing and that these options aren't necessarily available in their home community. Lots of conversation that there are just a lack of rental options, particularly in major employment centers, and that ultimately that has the impact of making it difficult to attract and retain workers, which obviously has economic impacts, and then quite a bit of conversation about construction defects as well. As I mentioned, we did have sort of this online resource out there to have the public kind of tell us what they're thinking about when it comes to the issue of housing. So we asked questions like, what's more important to you when you think of deciding where to live? And really, most folks talked about the neighborhood first, the house second, and the neighborhood first. And that was really interesting to us. But the second set really kind of speaks to what I mentioned before, is that really people were identifying housing needs across the spectrum. Yes, sure, there is a need for market rate affordable and subsidized affordable, but other folks were looking for senior housing options as well as single family to own options. So just lots of needs across the spectrum there. So a little bit more kind of on the data side from the housing strategy. Really over the last 30 years, our region added about 1 million people, and the expectation over the next 30 years is pretty similar. We'll add another 1 million people. But in the previous 30 years, really our overall housing portfolio did not change all that much. We remained pretty stable in terms of how much single family we have, how much multifamily we have, how much owner product we have. And really it's sort of an unanswered question, is that sustainable over time? We are seeing across the region declines in home ownership rates. Overall, as a region, we've been very fortunate that our housing prices have generally kept pace with incomes, but that's something that you have to wonder long term, because that's a very rare thing. Many regions have not had that luxury. But the reality is that those at or near poverty are facing historically high rents and very, very low vacancy rates. And coupled with that is just an overall increase in consumer goods spending as well. So some of the affordability issues that were uncovered during that work is, in general, and some of this work is now 2 years old, and obviously our housing market moves very fast, and so some of this I could almost say feels a little bit dated. But in general, a renter had to earn $40,000 a year to afford the median rental unit in our region, with over half of renters in our region being cost burdened, which means that they're spending more than 30% of their income on housing. We do have some affordable submarkets, but the competition for that space is really intense. At the time that we did this analysis, we were getting vacancy rates at about 2.8%, and when I rolled that out to sort of your local staff, they were like, "That's too high." That we had areas that are more like 1% or less, which is just even less than just churn. That is literally someone moves out and someone's ready to move in the very next day. So really high competition for those sorts of spaces. And then Denver just has an interesting dynamic in the sense that they have some of the most affordable units in the region, but they also have some of the most expensive, and that really there's a lot of give and play with that equation. That's just obviously something to sort out. So that was the rental side. On the sort of ownership side, dramatic price increases in this region over the last 10, 12 years. We're one of the very few regions that have actually now passed peak. The housing sort of boom that the country experienced, most are still recovering from that. Our region has actually now surpassed peak, so we've had significant increases in the costs associated with owning a home, with large gains in places like Boulder, Denver, Douglas, and Broomfield. The average, the median increased by about 75,000. All of those places ultimately saw increases above the median. Everyone else was below. And the cost burden ultimately also impacts this group as well. Nearly 225,000, about 31% of owners are actually cost burdened as well. And the same thing we heard with the rental on the mismatch between job centers, we heard the same thing on the owner-occupied side as well. If you go to look for a $250,000 home close to a major job center, you're just simply not going to find one. They don't exist. And so that's obviously a challenge moving forward. So as I mentioned, this is something that was actually in the regional economic strategy, but it does really kind of show kind of our region relative to 6 other places that we find ourselves competing with quite a bit for business expansion and relocations. Of these, so Atlanta, Austin, Dallas, us, Phoenix, Portland, and Salt Lake City, we are now the most expensive housing market. And that may ultimately become an anchor down the road, because you have to convince people to move their employees here and that they can afford a home to live in. And so that's just something that bears watching over time, that again has connections to other issues that we're interested in. So I'll walk you through really what's in the packet. It's the last 2 pages. As I mentioned, this was really developed by that ad hoc committee. So I'll walk you through what I have on the slide, but I would certainly encourage you to maybe pay more attention even to the last 2 pages of your packet, so you can sort of understand where they ended up in terms of thinking through outcomes, objectives, and strategies. They really kind of landed on one single outcome, that this region in the future will have diverse housing options that meets the needs of residents of all ages, incomes, and abilities. Really carrying forward that theme from the previous MetroVision plan about really focusing on thinking about the continuum of people that call our region home. With that, they really sort of thought of 2 key objectives that are really kind of the things that we focus on to make sure that we're on that path. Thinking about increasing housing affordable to those households at all income levels, and then really taking advantage of the transit system that this region is building. Thinking about how we can ultimately think about housing and that infrastructure investment simultaneously, so that people do have access to the opportunity that transit system provides, and that frankly there's housing available to them within those areas. And so then sort of a longer list of the types of strategies, and again, your packet has more details, but focusing on removing regulatory barriers to creating affordable and workforce housing, really getting creative to make sure that we can develop the desired types of products, thinking about sort of the mega trends, like what is changing in terms of consumer preferences and demands for housing, and are we up to date and aware of this, and are our communities able to respond to make sure that if the private sector is willing to build something that the community supports, that can happen. Again, as I mentioned, it came up multiple times, but just thinking about housing, particularly in job-rich centers, is really a key thing that came up in a variety of ways throughout the conversation. And then, housing is a really key element of our region's work, your local community's work of thinking about creating transit-oriented communities around both fast tracks as well as sort of the other transit amenities that we have around the region. So that was Fire Hose version 2. Well, it looks like we've got plenty of time for discussion, so I'll turn it over to the chair.
Questions and comments? Seeing none? No, I'm teasing. Councilmember Quinn.
Thanks. Just kind of a comment to begin with for those who were not part of the ad hoc housing group. We had what I would describe as vigorous discussions about this topic, and literally banged this out one word at a time. Sometimes spending 20 to 30 minutes on individual words. So I just
change them now.
now those are all bad words, but I just kind of wanted to add that right at the beginning of the discussion, that it was obviously this is just the start of our discussion about it, but we just want to make sure everybody was aware that it was a very vigorous and interesting discussion throughout, and a considerable amount of work went into it. Thank you.
This group could spend 10 words on one word, right? Yeah. Mayor Cernenik.
And just to add to Tom's comment, for those that are only looking or only looked at the electronic version, recognize that it's only the last 2 pages of the attachment that were the committee work. The part that comes from the regional housing strategy is interesting and was available to the committee. But recognize that regional housing strategy was a study that was done, and it really has never been vetted even at the board level. And so the recommendations that are in there. So as we move forward in our discussion, maybe Brad can add to that. My personal sense was, as far as for our discussion this evening, the 2 documents should have been the 2 pages that the committee worked on with a reference document at best of the regional housing strategy, as opposed to the way they might have been sequenced, or for those folks that only previously had looked at the electronic version.
I'll just say sorry for the confusion, but just to the mayor's point, our expectation as staff is that the regional housing strategy is not something the board will ever really take action on. That was never the intent. It was simply to be, as I mentioned, a part of the conversation as to, what does the board think the issues are related to the issue of housing? Do they warrant inclusion and integration into MetroVision? And then how might we actually proceed from there? So my apologies if you got confused, but really it's the last 2 pages of your packet are really kind of the work, the hard work that Tom and his fellow colleagues put in on that outline for this, obviously the full board consideration.
Other questions or comments? Okay. This is informational only.
Informational only, but did I just hear we weren't really going to ever put this in MetroVision? Is that what you just said?
No, I'm sorry.
Because I thought that's what I heard. I was like,
sorry.
what? That was a lot of meetings that we're never going to look at it again.
I tried to clarify confusion and cause more. Phil was mentioning the regional housing strategy, which was obviously sort of something that was part of the work to think through the issue of housing, and so that's the executive summaries included in the packet. But really, the board will ultimately take action on MetroVision. That as the draft that you will see at the workshop will include, word for word, the work of the ad hoc committee. So that will be something that will certainly be discussed.
Mayor Pro Tem Millay.
I just have a question about when that 50% housing goal was established, there was an urban center definition, and this is, could be just DRCOG myth, but has the definition of an urban center evolved or been modified or changed in any way since that original? And could we, and I think it has, and could you explain? Could you send some information to educate the board about when that goal was established, what urban center was defined as, and kind of what we've defined urban center as today? And I would really like, I think we've got some really great examples of urban centers, and I think there's real opportunity to learn from them. And I guess, Jennifer, you and I have talked about this. I really would like to be better educated on the really successful urban centers, where they are, what is it that they're doing, what is the job and housing mix associated with it, what is the transit, whether it's light rail or whether it's a bus system that serves it. Are there, what are the pieces in those puzzles of those urban centers, and even potentially what is the, healthcare system and grocery stores and that whole, those seem to be successful areas. So what are the components that are making them a draw for business and jobs? What conclusion? Because in some earlier version of something, and I wish I could remember what it was, I thought they talked about 3 very high-performing urban centers. And I just think we would all benefit from having a better understanding of what exactly that means.
Speaking of education, if you're not one of the 37 folks who have signed up for the workshop, please do so. There will be lots of educational opportunities at the workshop, breakout sessions, some information on the 101 of DRCOG, Robert's rules or Bob's rules, not mine, but another Bob. So it's going to be very informational, and if you're not one of those 37, please sign up. Mr. Graves.
Bob, excuse me, Mr. Chairman, your rules are pretty great in my book, let me just say. So just want to speak in support of this process and thank all of the committee members for the thoughtful dialogue around this. And I want to remind everybody that really housing continues to be a very high priority for the city and county of Denver. And point of fact, as a reminder, Mayor Hancock has initiated this Friday a Bridging the Gap, a solutions forum on housing, and Secretary of Housing and Urban Development, Julian Castro, will be keynoting that conference. So again, speaking in support and thanking everybody for their time.
Other questions or comments? Okay. Mr. Calvert, next steps.
Just a few quick things. Obviously, as many as I hope I said today, but many of you pointed out today, this is just the beginning of this conversation related to the update of MetroVision. We are targeting really the board workshop as a time to give everyone a full copy of the draft that ultimately staff has developed with stakeholders and technical committees to begin sort of the full deliberation. I know, having worked with the ad hoc committees, sometimes it's tough to look at these things in isolation because you don't necessarily see the connections. And obviously one of the things that we've talked about with both of these issues is how connected they are across issues. And so that will be a chance for all the board members that come to the workshop to really begin that conversation. For better or worse, you're going to see a lot of me over the next couple of months to continue this conversation about how MetroVision evolves to meet the sort of changing needs in this region that the board feels like that we need to be addressing. And then, we are hopeful that we will be adopting an updated version of MetroVision in the summer of this year. And that's really it, Mr. Chair.
Great. Mayor Cernanek.
Yeah, Brad, I was just going to say, going through this document again reminds me of something that Commissioner Partridge really tried to drill home in some of our committee discussions, which is how do we make sure that the plan itself that we put together and the words are indeed a guiding document as opposed to a prescriptive document. And I don't know how that actually happens or occurs, but having someone with a sensitivity to how some of those words and pieces could be interpreted differently might be good. And I don't know if there's time between now and the workshop to have it happen, or there's going to be, when is that recognition and that I'll refer to it as polishing going to necessarily occur, so that we're not doing what Tom talked about earlier, which is spending a lot of time arguing over single words.
Good deal. So I'd like to thank Brad for the presentation and for the Evelyn Wood speed reading. So real quick, any other matters for the good of the cause? Seeing none, we are adjourned, and please remember to grab your nameplate and take it out to the table. Save Connie just a little bit of time on that. And thank you very much. Drive safely. Absolutely. Thanks. You know what they say, the sun even shines on the dog's ass every once in a while.
what's good is generally like do you like meals or like lunch or prefer you never used to, so I used to always like either.
More of a coffee, yeah. We'll just
Yeah, I know. Same. I'm just checking. Least I know. The only other option would be this meeting next month. Come early. It starts at 4.
So we always have a board officer meeting.
All right. So have you been elected president yet around here? Have you been elected president? Soon. President?
In a year. Because Jackie's getting a year and a half.
Right. Okay. I was just thinking of things when you might be here or the rack. Any other reason you're in Denver? That's the easiest. Otherwise, I'll come to Boulder.